I'm Claire Barlow. I'm co-founder of Maternal Pituitary Support. I have chronic Sheehan syndrome, and that means that it comes on over time. So I had my baby 5 years ago, and I was diagnosed when she was nearly two. And the early and persistent warning signs were unfortunately missed.
Hello, my name is Jen Kenworthy, and I'm also co-founder of Maternal Pituitary Support. I had an acute presentation following the birth of my son 10 years ago, and unfortunately, the early warning signs were missed. So I presented with adrenal crisis and admission to critical care. I've got a diagnosis of Sheehan syndrome. However, currently there's some discussion as to whether this might actually be lymphocytic hypophysitis.
Can you tell us how and why maternal pituitary support was created and who it supports?
Yeah, so when I eventually got my diagnosis, I was frantically looking for some support and quickly realized there wasn't anything. There was nothing, there was hardly anything on the internet. And my endocrinologist suggested I contact the Pituitary Foundation in the UK, which I did. And I was like, have you got a specialist? Is there someone I can talk to? And they were like, actually, no, we don't know any specialists. But a lady called Jen contacted us a few years ago and said, if anyone gets in contact with the same condition, to please put them in touch with me. And that was it. So I remember speaking to Jen. It was about spring 2021. And I was in the garden at home, basically just sobbing my way through our conversation. I just like, I have found someone else with this condition because you're told it's so rare, you can't find information about it. And it was just such a relief to find her. And at that moment, I know, and at that moment, we both vowed no woman is ever going to have this again. We will always be there to support them. And that was it. And so now we have 70 members of our community. You can join from anywhere in the world, and it's free. It takes place all online on a virtual app where it's secure. And we have socials where women can meet each other face to face online. And actually, that's led to quite a few meetups in real life, which is really, really amazing. We always ask for them to send a photo of them together. I actually met someone as well from London as well. It's really powerful. And yeah, we also have endocrinologists, and we've had a trauma resolution specialist, birth trauma resolution specialist, and nutritionists coming to talk to our community. And our mission is to be the global leading community and advocacy group for women with maternal pituitary conditions.
What pituitary disorders can present during pregnancy or the postpartum period? And how are they diagnosed?
Okay, so the pituitary gland in pregnancy undergoes a huge change. We know that it's the control center for all the hormones in the body. And when you're growing a baby, it's just under a huge amount of strain. So the pituitary gland is normally the size of a pea, and it swells massively to cope with all of these hormonal demands. That means that it's incredibly vulnerable. We know that it relies on one blood supply, which is through the hypothalamus. And so if anything happens, that pituitary tissue is at risk of not getting enough oxygen. So the pituitary conditions that can arise in pregnancy and postpartum, first of all, we've got Sheehan syndrome, and that's where the pituitary gland has been starved of oxygenated blood, and that causes the tissue to die. So you get hormone deficiencies, and those can present really early on. For example, with me, when my son was 13 days old, that was when I was admitted with adrenal crisis. Or the damage can present much later and much more gradually, and that can be really, really difficult to pick up. And so the cause of this could be perhaps a postpartum hemorrhage, or it could be some episodes of severe low blood pressure that basically just starve this enlarged pituitary gland. Another condition is lymphocytic hypophysitis, and that can present in pregnancy, and it can also present postpartum. And that's an autoimmune condition. So the enlarged pituitary gland is detected to be some kind of invader, and so the body attacks it, the immune system attacks it. And in pregnancy, that can present as visual disturbance, severe headaches. It can even affect vision completely. And so that becomes an emergency. And in cases where the optic stalk is compressed, people might need to go on and have transsphenoidal surgery to decompress that. In other cases, it might be that, that's not needed, but postpartum, that enlarged pituitary that's enlarged further because it's being inflamed and attacked, can then cause hormone excesses. So, for example, lots and lots of milk being produced. If there's then damage because it's been compressed, you can then have hormone deficiencies, which can be ongoing. And that might, again, be an acute or a chronic presentation, depending on what's happened. And we've then got pituitary tumours, which we understand because of, the enlargement of the pituitary, it can mean that they're more likely to be detected postpartum, which perhaps might be hormone deficiencies or hormone excesses. And then finally, in some very rare cases, there can be cysts on the pituitary that can be linked to an infection in the postpartum period. How are they diagnosed? Well, early detection is key. And, what we're saying is that regardless of an acute or a chronic presentation, the earlier that these can be picked up, the better. And so really, ideally, that would be with, simple pituitary blood tests following, common risk factors being detected on the maternity ward, and then a urgent referral to endocrinology.
What are some of the warning signs to look for during pregnancy and the postpartum period, which could indicate a pituitary disorder?
So in pregnancy, we've got visual disturbance and we've got severe headache. We might also start to show some signs of hormone excesses or deficiencies. So, for example, there's a lady in our community and she was admitted with a different condition, and they just happened to run a pituitary blood test, and it detected low cortisol. So they were able to piece together the information and understand her symptoms because of that. In the postpartum period, so risk factors, we've got a history of hemorrhage of any size and episodes of low blood pressure of any amount. The key symptom, the key red flag to look out for is either a lack of breast milk or reduced breast milk production. Or perhaps in the case of lymphocytic hypophysitis, an excess of breast milk production, which I understand is it could be quite difficult because there's three, variations there really, but it's anything out of the normal. If somebody has got vomiting or diarrhea, severe headache, visual disturbance, perhaps drunk-like behavior, excessive thirst, excessive urine output that would be way out of the normal for a pregnant or a postpartum woman. And then further down the line, we've got fatigue and exhaustion that just won't go away. You're out of the period of time where you would be expected to still be recovering from your birth, but you're still exhausted, and that's not recovering. We've got periods that either are irregular or haven't returned. We've got unexpected weight gain, unexpected weight loss. So it can be quite difficult to pinpoint, but really it's where there is something that is out of the ordinary and there's just no reason why that person is not feeling better. That would be the time to go to the GP and to explain something's not right, and it's been since my birth, and I need to have some pituitary blood tests.
How does having a pituitary disorder affect pregnant women?
So having a pituitary disorder, it can mean that your LH and FSH, which are hormones that are released from the pituitary to stimulate the production and release of an egg in the ovaries, that can be affected. So really sadly, it can mean that that women can find that they have infertility. The good news is that it is possible to have another pregnancy and to go through fertility treatment to stimulate that release of an egg. However, understandably, there are some women that decide not to go through that because of their past experiences, and that can be really hard, and there can be a lot of grief around that. We've got a lot of support around that in our community. And we also support women who have decided to go through that process and who have been able to successfully have another baby. In pregnancy, there are important things that an endocrinologist and an obstetrician would have to work together to manage. So that's usually the thyroid hormone and the cortisol needs to be managed carefully to make sure that there's enough to help the growing of the baby and the additional demands on the body. And usually there's a change to the growth hormone as well, and that needing to stop.
What do new mothers with a pituitary condition have to face in addition to the usual challenges of motherhood?
As you can imagine from what Jen's just described, it has a huge impact on their lives, and that in turn has an impact on the lives of the family and the children. So it takes a long time to get everything tested and to get on adequate hormone replacements. So if you also imagine that those women who might have chronic Sheehan's and it might not have been picked up in those early weeks and months, the average time to diagnosis in developed countries is 9 years. So if you think that women are going on with their lives with a child with all these symptoms, they're going to be feeling really unwell. So we're determined to bring down that time to diagnosis by raising awareness of this condition. But when a mother is trying to care for the baby, they really need support from others. They'll be feeling really unwell. They'll be feeling probably quite anxious. They'll have not only physically, they'll be feeling unwell, but emotionally and mentally, they'll be feeling really anxiety. They'll be having anxiety, depression. Their mental and physical health will be deteriorating. But once they're diagnosed, it takes a while to get on the replacements because each one has to be tested, tweaked, tested again. And I was thinking that it would only be a short amount of time and I'd be back to normal. But actually, it's taken 3 years for me to get to the point where every hormone is now pretty much balanced. So they'll have regular hospital visits, regular blood tests, regular GP appointments, and they're going to need some real help and support going forwards to be the best mother they can be for those babies.
How can women with a maternal pituitary disorder advocate for themselves if they feel that something is not right?
It's really, really important to keep raising your concerns with the health professionals around you. We know that that can be really difficult because maternal pituitary conditions, they have kind of slipped off the radar. There's a misunderstanding that because of improvements in obstetric care that they've been eradicated, and that's really not the case. So keep advocating for yourself. One thing you can do is if you're still on the maternity ward, you can ask to speak to the doctors and say that you think that there might be something wrong with your pituitary gland. If you're at home, you can speak to your midwife and ask them to advocate for you as well. You can go to your GP and explain what you think is going on and ask for some pituitary blood tests and a referral to endocrinology. One of the best things you can do is if you could write down a list of your symptoms, write down, it's sort of like a one-page document that you can take with you. Write down the history, so everything that happened in your pregnancy, your birth, and immediate postpartum. Write down your symptoms, and it's almost like a diary of what's going on and what you're feeling when. We all know that when you go to see, the GP or the doctor, it can be really easy to forget the things that you want to discuss. You're under pressure, you might have waited a long time for that appointment. So having that piece of paper with you will just help you to communicate everything you need to let them know. Another thing you can do is if you go on our website, there's lots of information on there. There's information for your health professional as well. So you can direct them there. Perhaps they might not have heard of these conditions before. So they can get clued up as well. But the most important thing really is that sometimes you can advocate for yourself and you still don't get anywhere, and that's not your fault. It's not a lack of you trying, it's the fact that these conditions are just not widely understood at all. But in that case, come to us and come and join our community, and we can support you and we can help you to hopefully get a little bit more progress with that.
What is the best way to support pregnant women or new mothers with a pituitary disorder and their families and caregivers?
Well, actually, this is exactly the topic we're going to be discussing on the 20th of October, which is World Maternal Pituitary Awareness Day. So I've got a list of do's and don'ts here, because this is lots of these can be quite triggering. And I spoke to some of the members of the community and they've helped compile this. So do offer practical help, lend a hand, daily tasks such as making tea, running errands, looking after the children or baby when the mother has to go to hospital appointments. Do be empathetic. Just because you can't see the illness does not mean it isn't affecting her. Do listen actively, be open to hearing about her experiences and her struggles without judgment. Do ask how she's feeling, check in regularly about her physical and emotional well-being. And do be sensitive about triggers. Discussions around childbirth, pregnancy, fertility, breastfeeding can be emotionally challenging, so tread really carefully. And do be patient, allow things to take their own pace, and recovery can be a long process. So don't assume she's fine because she looks fine. Don't mention having another baby. She may be dealing with infertility. Don't mention breastfeeding or comment on why she might be bottle feeding her baby. Don't mention periods or menstruation. They may not have returned and she's likely to be on HRT. Don't make comparisons to how she was before or other people with conditions. I can see Jen's face as well, because some of this is exactly what we've received. Don't say you look great or you look fine, because actually they might not be feeling fine or feeling great. Don't comment on weight. That's a big one. Weight management is really often quite difficult after a pituitary disorder, and commenting on weight just makes it increasingly more stressful. Don't expect her to bounce back. Both physically and emotionally, recovery can take a lot of time, and she may not ever return to her pre-pregnancy self, unfortunately. And don't rush her. Healing is a slow process, and pressurizing her to recover can be harmful.
Any final advice for women who have recently been diagnosed with a maternal pituitary condition?
So it's really hard being diagnosed with one of these conditions. People don't understand. They've never heard of the pituitary gland. And as Claire's just said, quite often you just look fine, but on the inside, you've had a catastrophic injury. And it's important to remember it's not your fault that this has happened. Your body's been injured through no fault of your own. And it's going to take a long time for you to get everything in place that you need. So come to us. We're here for you. We're going to wrap you in a big hug, and you can come and meet other women who understand exactly what you're going through, and you're not alone.
The other thing that I would add to that is, we've spoken about this a lot in our community, is that idea of trying to find yourself again, because you just don't feel like yourself. And truthfully, you might not ever feel like yourself again. The old you might not be there. However, it isn't the end. It's just the beginning of something that's a bit different, and actually reconnecting with things that you used to love, that you used to do. When you start to feel better, even just reading a book again. I've just started reading a book. I've just started slowly doing yoga again. And it's just those small things that make a huge difference to your mental and physical health. And you just think, I can be this person now, and I can feel good, and I can take care of my baby and my family. It's not the same as before, but it's okay.